The Board of Commissioners in Ottawa County has voted to move nearly $2.5 million from the Public Health and Child Care funds to its general fund. 13 on your side political reporter Josh Albertus was at that meeting today and explains how commissioners voted and reaction from people who live there.
While last year's budget feuds between the Ottawa County Board of Commissioners and county health leadership may have come to an end, funds for public health in the county were once again in the spotlight at the board meeting on Tuesday. The board voting to move nearly $2.5 million from the public health and child care funds to the county's general fund.
So as we prepare for our fiscal year 2025 budget, getting some of these steps in place.
The dollars that were moved were excess funds that had not been used already. Because requests need to be made from departments to access money from the general fund, the move is seen by some as a way to increase transparency and good accounting.
I think it's really important for transparency that we go ahead and proceed on these two amounts that have been identified as being much higher than they should be sitting in a fund. So that when it comes to budget season, it's very clear what the county is doing and that the public can understand that.
Others, however, feel the move may make it harder for the health department to respond to emergencies without immediate access to that money. When we reached out to the health department for comment, Deputy Health Officer Marcia Mansaray, who also spoke during the meeting, said hers was more of a neutral response, but not without concerns.
In the past, it's been a comfort to have. I'm concerned that when we need it, we might not be able to get access no matter where it is.
The chairman asserting, however, that the county is in a good position to respond to any potential emergencies.
I guess it's worth mentioning is also very rigorous and extensive emergency planning set up. So if there are any emergencies, the county is ready to respond and does so whenever is necessary.
But some also felt a new policy for excess department funds should be made, and that this transfer shouldn't have happened until one was in place.
I understand that this can, we can respond, but it seems to me that we're just putting the cart before the horse, and I don't see any reason why we can't wait with this allocation until we come up with a policy.
A policy the county's fiscal services director says is now in the works.
And Josh joins us now. Josh, were there any concerns that people brought up during this meeting?
Others included at least one person sharing a concern over how taking this money out of the health fund could impact union negotiations within the county with concern to health workers. You can find even more on those concerns in the full story that will be up on our website later tonight, 13onyourside.com.
Josh, thank you. Let's take a final